Good morning, everyone. My name is Kenny Wu. Thank you for waiting, everyone. And I'm the program coordinator here at Wildcardinal CTSC. Thank you for joining us today on our Power Over Diabetes presentation. Today, we're joined by Ruben Diaz from the Hospitals for Special Surgery. This presentation will be done in English and Spanish. If you want to ask any questions or you want to talk to the presenter, there's a chat function at the bottom of the screen. You can type in a question and the presenter will be able to answer it during the Q&A section of the presentation. Um, at the end, we will also have a short poll about today's presentation. Please fill it out if possible. Muy buenos días, mi nombre es Kenny y yo soy el coordinador de programas en Wildcardinal CTSC. Muchas gracias a todos ustedes por atender nuestra presentación el día de hoy. El día de hoy vamos a tener una presentación sobre el poder sobre la diabetes. La presentación va a ser en inglés y español. Si tienen preguntas, en la parte de abajo hay una sección donde pueden enviar un chat o un mensaje. El presentador del día de hoy es Rubén Díaz. Al final vamos a tener una encuesta sobre la presentación. Por favor, llénenla si pueden. Esta presentación va a ser grabada. Si quieren verla de nuevo, ustedes pueden acceder a nuestra página de YouTube.
Good morning. I'm Ruben Diaz, nurse practitioner. I'll be going over Power Over Diabetes. This will be presented by myself today. My colleague, Joan, could not attend today. Hospital for Special Surgery. So it's a specialty hospital for orthopedics and rheumatology, #1 in orthopedics and #3 in rheumatology in the nation. We do have a magnet recognition program for nursing excellence. And our mission is to provide the highest quality care, improve mobility, and enhance the quality of life for all. El Hospital de Cirugía Especial es especializado en ortopedia y reumatología. Es #1 en ortopedia y #3 en reumatología en la nación. El programa de reconocimiento Magnet para la excelencia de enfermería y la misión de nosotros es proporcionar atención de la más alta calidad para mejorar la movilidad y mejorar la calidad de vida para todos. So thank you for attending today's session. At the end of the class, we will ask you to take a short survey to help us see how we did and find out a little bit about you. Surveys are anonymous and they'll help us to improve our sessions. So if you can fill it out, we will be grateful. Gracias por asistir a la sesión de hoy. Después de la presentación, les pedimos que llenen una breve encuesta para ayudarnos a saber cómo hicimos y saber un poco sobre ustedes en general. Las encuestas son anónimas y nos ayudarán a mejorar nuestras sesiones, por lo que si puedes rellenarlo, estaremos muy agradecidos. So the objectives today are to define prediabetes and diabetes, list the risk factors associated with diabetes, review the symptoms of diabetes, create awareness about prediabetes and diabetes management, and integrate healthy messages and activities into your life. Recognize A1C as an indicator to both diagnose diabetes and evaluate diabetes control. Los objetivos de hoy es definir prediabetes y la diabetes, enumerar los factores de riesgo asociados con diabetes, revisar los síntomas de diabetes, crear conocimiento sobre el manejo de prediabetes y diabetes, integrar mensajes saludables y de actividad en su vida, y reconocer A1C como un indicador para diagnosticar diabetes y evaluar el control de diabetes también, que ya está establecido. So going back to the body's metabolism, so naturally, without diabetes, when we eat food, mainly starches, they're broken down into glucose, sugar, basically. This is for people with or without diabetes. This would be what the normal body metabolism is supposed to do. Glucose then enters the bloodstream through the small intestine. And when the cells in the pancreas sense this increase in the sugar in the bloodstream, it sends insulin into the bloodstream. And the insulin then attaches to cells to open up the cell walls so sugar can move out of the bloodstream and into the cells. And these cells are primarily in the muscles, brain, heart, and liver for energy. El metabolismo natural del cuerpo, cuando comemos comida, principalmente los almidones, se convierten en glucosa. La glucosa ingresa al torrente sanguíneo y a través del intestino delgado. Cuando las células del páncreas detectan el aumento de azúcar en la sangre, envían la insulina al torrente sanguíneo y luego la insulina se adhiere a la célula para abrir las paredes celulares para que el azúcar pueda salir de la torrente sanguíneo y entrar en las células. Estas células son primordialmente en los músculos, cerebro, corazón y hígado para obtener energía. What is diabetes? When you eat, your body, like we saw before, breaks down what you eat and drink into sugar. This is primarily the carbohydrates and sends them into your bloodstream. And when the insulin, which is a natural hormone, gets the sugar from the blood into the cells, this is used for energy that we need for daily life. So insulin is like the key that opens the door for the cells. Diabetes is when the body does not make insulin, as in type 1 diabetes, or when the body does not make enough insulin, or the insulin it makes does not work well. That's primarily type 2 diabetes. The sugar would stay in the blood and the levels build up because it cannot get into the cells that need it for energy. ¿Qué es la diabetes? Anteriormente repasamos como cuando come, su cuerpo descompone lo que come, primordialmente los almidones y también lo que bebes que contenga azúcar y lo envía al torrente sanguíneo y la insulina ayuda el azúcar a entrar en las células. Diabetes tipo 1 es cuando el cuerpo no produce insulina o tipo 2 es considerado cuando el cuerpo no produce, el páncreas no produce suficiente insulina o la insulina que produce no funciona bien. El azúcar entonces permanece en la sangre y los niveles se acumulan porque no puede ingresar a las células que lo necesitan para obtener energía. What is prediabetes? Sometimes people call it a little bit of sugar, a touch of sugar. A provider might tell you the sugar is elevated, watch what you eat, and try to exercise. But it's important to know what the actual values are. When a person has too much sugar in their blood, but not high enough to be called diabetes, that's prediabetes. Most people don't know they have it yet. Lifestyle modifications. People with prediabetes can make changes to their eating habits and physical activity to reduce or maintain a healthy weight to delay or prevent diabetes. And sometimes this does include starting a diabetes medication, but not always. And this depends on the conversation you have with your provider to see what's best for you. Eating healthy is for everyone, but this is especially important to manage or prevent diabetes. If you have prediabetes or diabetes, your activity level, what and how much you eat can affect your blood sugar. And below, when you have a chance and you review the slides, you can review the difference between normal lab values for blood sugars, pre-diabetes lab values, and diabetes. Often people have an A1C of 5.7 to 6.4, and that's really pre-diabetes. And we may review that on subsequent slides. ¿Qué es prediabetes? A veces la persona dice, tengo un poco de azúcar, un toquecito de azúcar, quizás el proveedor de salud le dice que tiene el azúcar elevada, que tenga cuidado con lo que come y que haga ejercicio, pero es importante saber cuáles son los niveles actualmente y tener una meta. Prediabetes es cuando una persona tiene demasiada azúcar en la sangre, pero no lo suficiente para ser llamado diabetes. La mayoría de las personas que tienen prediabetes no saben que lo tienen. Es importante las modificaciones del estilo de vida. Las personas con prediabetes pueden hacer cambios en sus hábitos de comer alimenticios y nivel de actividad física para reducir o mantener un peso y mantener peso saludable para retrasar o prevenir la diabetes. Comer sano es importante para todos, pero especialmente para controlar o prevenir diabetes. Si tiene prediabetes o diabetes, su nivel de actividad, qué y cuánto come, puede afectar su nivel de azúcar en la sangre. Y debajo puede ver niveles que califica azúcar normal, prediabetes y diabetes, que a ver si vamos a repasarlo en siguiente. Diabetes tipo 2 es el tipo de diabetes. Hay por lo menos 3 tipos de diabetes. Type 2 diabetes, there are about 3 major types. There are subtypes, but the most common ones we'll review today. Type 2 diabetes, approximately 90% of people in that diabetes category have this type. This is when the body produces insulin, but not enough, or the type it produces is not being used effectively. This develops mainly in adults after age 40, but we have seen this in overweight children and adolescents with intake of nutrient-deficient foods or intake of nutrient-deficient foods, too much of it, and lack of physical activity, a sedentary life. Treatment or management is aimed at lifestyle modifications, which is a focus on nutrition and activity level. And medication, like I said before, is sometimes incorporated. This includes oral medications, non-insulin injections, or even insulin. And testing blood sugar is very important to see where you are on a day-to-day basis when you're not interacting with your provider. Diabetes tipo 2, aproximadamente 90% de las personas tienen este tipo de diabetes. Es cuando el cuerpo no produce suficiente insulina o la que produce no se puede utilizar adecuadamente. Se desarrolla principalmente en adultos después de los 40 años de edad, pero ahora también se observa en la juventud, en niños y adolescentes con sobrepeso, que ingieren alimentos con deficiencia de nutrientes y también falta de actividad física. El tratamiento se enfoca en la nutrición y actividad física y a veces también se incluye medicamentos, píldoras, inyecciones que no tienen insulina o insulina. Prueba de azúcar es importante para saber día por día en cuánto tienes los niveles en esos tiempos en los cuales no estás con su proveedor de salud. Type 1 diabetes, approximately about 6 to 10% of the population has this type of diabetes. It was previously known as juvenile or insulin-dependent diabetes. This is different from type 2 in that it's an autoimmune type of process. The insulin-producing cells in the pancreas are being destroyed, and there's no way to prevent it. In this case, the pancreas does not produce insulin. There are some insulin producing cells in some instances, and there is something called the honeymoon period. But eventually, really, this will require lifelong insulin. Usually, this is diagnosed before the age of 14, occasionally under the age of 40, and sometimes an older age, which we have seen in the 50s and 60s as well. But it's primarily diagnosed early on in life. The treatment is insulin. Blood sugar testing is very important, especially in the setting of administering insulin. And nutrition and activity is still important for all of us and in this population as well. Diabetes tipo 1, aproximadamente 6 a 10% de la población tiene este tipo de diabetes. Anteriormente ha sido conocido como diabetes juvenil o diabetes dependiente de insulina. Es autoinmune. Las células productoras de insulina en el páncreas están siendo destruidas. No hay forma conocida de prevenirlo. El páncreas no produce insulina. Raramente sí permanecen algunas células productoras de insulina, pero no lo suficiente para sobrevenir, para controlar el azúcar y eventualmente necesita insulina para larga vida. Usualmente es diagnosticado antes de los 14 años de edad, ocasionalmente en aquellos menores de 40 y a veces en personas mayores hasta 50 y 60 años de edad también, pero normalmente en la juventud. El tratamiento insulina es bien importante y prueba de azúcar en la sangre, especialmente ya que está siendo tratado con insulina, es importante y modificaciones de estilo de vida para todos, comer saludablemente y actividades importantes. Diabetes gestacional, gestational diabetes, this is the third most common type. It's observed only during pregnancy. So this is something that was not diagnosed before pregnancy. And it is observed normally after 24 plus weeks of pregnancy. It disappears after delivery. The risk does not disappear, but the elevated blood glucose does. There are short and long-term complications. Risk to the mother include C-section, longer labor, future type 2 diabetes risk. And the babies, you can have macrosomia, which is a large baby with 9 or more pounds of weight at birth, future obesity and diabetes risk as well. Diabetes gestacional es observado solo durante el embarazo a más de 24 semanas obviamente no ha sido diagnosticado antes del embarazo. Desaparece después del parto, pero los riesgos de diabetes en el futuro no. Las complicaciones a corto y a largo plazo, riesgo a la madre, incluyen necesidad de cesárea, también trabajo de parto prolongado, diabetes tipo 2 es riesgo en el futuro, y para el bebé puede ser que pese más de libras, y también obesidad futura y diabetes tipo 2 es un riesgo para el bebé. Algunas preguntas en este momento que hemos hablado sobre varias cosas. Any questions at this time, since we've discussed a great deal of information up until this point, before I proceed?
There is a question that I just got asked. Should we eliminate all sugar?
No, so we don't recommend, first, we don't we don't recommend eliminating all carbohydrates. I'll call sugars carbohydrates because sometimes people forget that rice and potatoes and pasta and all of those things convert into sugar eventually. So sugar is a carbohydrate, and so is rice and pasta. So eliminating sugars and carbs is basically a keto diet. There are no recommendations that this is optimal for diabetes control. At least the research has not proven this. We recommend portion control and having sugar or carbs as part of your diet. But as recommended, we did a nutrition type presentation where you learn how to incorporate carbohydrates into your life and sugars. So we don't typically eliminate sugars so that we don't put you into ketosis.
And one more question. How concerned should I be with gestational diabetes?
So concern, I would say it's good to be concerned about your health and to participate. So what I would say is to work with your provider so that your concern, which is very valid for your baby and for your health, is to engage with a provider to have a plan as to checking blood sugars to see where they should be. And if you need insulin, that's absolutely fine, but just have a goal and parameters with your provider of where your blood sugar should be and what interventions you need. Not only maybe needing insulin, but specifically the nutritional aspect of gestational diabetes. And also remaining active throughout your pregnancy.
No more questions for now. Thank you.
Okay. I'll continue, and any more questions that come up in the end would be very helpful. Risk factors for prediabetes and diabetes, overweight or obesity, sedentary, rarely exercise, age 45 or older is a risk. There's an actual risk calculator that you can Google, especially from the ADA, where you can see what your diabetes risk is, and there's an actual score. And to have a conversation with your provider if regardless. Ethnicity, so African American, Hispanic, Latino, Native American, Asian, these are, it's actually a risk factor. High blood pressure, having high blood pressure, 140 over 90 or higher, heart disease or history of stroke. Also family history, so I mean immediate family, that's parent, brother, sister with type 2 diabetes, and history of gestational diabetes and or having had a baby of 9 or more pounds at birth or with birth defects. Factores de riesgo para prediabetes, diabetes, sobrepeso u obesidad, sedentario, una vida sedentaria o raramente incorporando ejercicio en su vida diaria, edad 45 años o más, etnia afroamericano, hispano, latino, nativo americano o asiático, presión arterial alta, 140 sobre 90 o superior, enfermedad cardíaca o antecedentes de accidente cerebrovascular. Historia familiar, es familia inmediata, sea padre, hermano o hermana, con diabetes tipo 2, y también historia de diabetes gestacional o un bebé que ha pesado más de 9 libras al nacer o con defectos congénitos. Hay unas calculadoras que pueden accesar en la computadora por la ADA, que puede también ver cuál es su riesgo y definitivamente tener la conversación con su proveedor de salud. Risk factors for gestational diabetes, again, overweight or obese, excessive weight gain during pregnancy, sedentary or rarely exercising. You can continue activity as recommended by your provider throughout pregnancy. Age, over the age of 25. At pregnancy, previous history of gestational diabetes. Ethnicity, again, the same groups. And family history, again, immediate family member with type 2 diabetes history. And polycystic ovarian syndrome is a risk. And there is a theory of depression as to gestational diabetes, as to a correlation. Factores de riesgo para la diabetes gestacional. De nuevo, el sobrepeso u obesidad o aumento excesivo de peso durante el embarazo. Otra vez, es una vida sedentaria, haciendo ejercicio raramente. Es importante continuar actividad durante el embarazo, de acuerdo a su conversación con su proveedor de salud. Edad mayores de 25 años al empezar el embarazo. Historia de diabetes gestacional en embarazos anteriores. Las mismas etnias. Historia familiar inmediata, de nuevo, que ha tenido diabetes tipo 2. Síndrome de ovario poliquístico es un riesgo y hay una correlación entre la depresión y diabetes gestacional. Early symptoms of diabetes. There are some people that don't have symptoms at all. And there are those that most commonly would have frequent urination and increased thirst. Always thirsty, dry mouth, cotton mouth. Also feeling tired, weak, or just fatigued. Frequent yeast infections, increase in appetite, numbness, tingling, especially on the lower extremities, on the feet, maybe just the toes or maybe just one toe. It's usually on both sides. Dry mouth or throat, that goes with the thirst, and unexplained weight loss, or acanthosis nigricans, which you can see it's more like a velvety texture and darkened skin around the neck area. En los primeros síntomas de la diabetes, algunas personas inicialmente no tienen síntomas. Aquellos que tienen síntomas, deseo frecuente de orinar y sed constante, también cansancio crónico, fatiga o sentirse cansado o cansada, infección vaginales frecuentes, especialmente de orina, entumecimiento, hormigueo, dolor en los pies o las manos. Puede ser en los pies solo en los dedos y normalmente es en los dos pies. Aumento del apetito, sequedad de boca o garganta, que también va con la sed constante, o pérdida repentina de peso. Y también acantosis nigricans, que es, puede ver el oscurecimiento de la piel en el cuello. A1C, this is very important. This is a lab test that is done in the provider's office. They do sell the machine at Walgreens, but I recommend going to your provider so that there's someone to interpret it and have a conversation with you and develop a plan. But this should be, I highly recommend you do it with your provider, especially if you're over 45 years old. The A1C tells your blood sugar on average 24 hours a day, every day of the week for the past 2 to 3 months. It's like the blood sugar check with a memory. It's used to diagnose or to manage diabetes. It provides your healthcare provider with a baseline of how well your diabetes or blood glucose control is. Generally, A1C target is less than 7 if you already have diabetes, and diagnosis, there's a different range for that. On the right-hand side, you can see the chart where depending what your A1C is, it tells you what your average blood sugar is if you tested it with a finger stick blood glucose with a machine from over the counter with the strips, what it would normally be on average on a daily basis. El A1C es bien importante. Es el análisis de sangre que indica sus niveles promedio de azúcar en la sangre durante los últimos 2 a 3 meses. Normalmente su proveedor de salud hace este examen, pero también venden la máquina en la farmacia, pero recomiendo que lo haga en la oficina de su proveedor, porque así con los resultados pueden tener una conversación y tener metas sobre mantener o controlar. Eh, es utilizado el A1C, como he dicho, para diagnosticar o también manejar diabetes ya con una persona que tiene diabetes. Proporciona a su proveedor de salud con referencias sobre su control de diabetes o azúcar en la sangre. Es la memoria de la sangre. El objetivo general de A1C es la meta de 7 o menos si ya tienes diabetes. Y a la mano derecha pueden ver, dependiendo de en qué nivel tenga el A1C, también indica diariamente a dónde tienes la azúcar en un promedio diariamente, si se está examinando el azúcar con la máquina de la glucosa que venden, que tienen las tiritas. Blood glucose testing at home, finger stick. So if you're doing this at home, or if you're going to do it, it's really a drop of blood that is obtained with the lancet, a very small needle. A blood sample is placed on the test strip by you or a caregiver that can assist you. And the glucose meter displays the blood sugar concentration at that point in time only. How many times per day you have to test depends on the status of your diabetes. And some people find it uncomfortable, but the more you test, the more you know, you can plan and take action. Normally, it should be 80 to 130, the range, no more than 150 to 180. Prueba de glucosa en la sangre en el hogar, la punción en el dedo, se obtiene una gota de sangre con una lanceta y la muestra de sangre es colocada en la tirita, en la tira de prueba, y el medidor de glucosa muestra la concentración de azúcar en la sangre solo en ese mismo momento. ¿Cuántas veces al día tienes que hacer este examen? Depende del estado de su diabetes. Algunas personas les resulta incómodo, pero cuanto más pruebas y más información tenga, puedes planificar y tomar medidas. Normalmente se desea el rango de 80 a 130 y no más de 150 a 180. Partner with your healthcare provider, develop a plan for your diabetes. You can get new diabetes information, classes, and treatments that you may not be aware of or can help you access them. Take your blood glucose results with you, please, the machine, if you write it down, and request your test results, your A1C, your blood pressure, your cholesterol, to make sure you're on track and to have a goal and discuss your results and medications if you're taking. Review or request a nutritionist referral to help you with that lifestyle modification piece, which is always the foundation, regardless of whether someone is on diabetes medications or not. And ask if you can exercise and what exercises you can do, and physical therapy if needed. Asóciese con su proveedor de atención médica, desarrolle un plan para su diabetes, puede proporcionarle nueva información sobre diabetes, clases y tratamientos, puede ayudarlos a tener acceso a programas que si, quizás usted no sabe que están disponibles. Lleve sus resultados de glucosa de la sangre con usted, la máquina, sea si usted lo escribe a mano, y solicite los resultados de su prueba de A1C, preguntar cómo tiene la presión y el colesterol y tener metas para mantener su salud. Discuta sus resultados y medicamentos si toma con su proveedor y revisar o solicitar un referido para nutricionistas, porque comer bien y el ejercicio se mantiene la fundación de modificaciones de estilo de vida para controlar diabetes, aunque esté en medicinas para diabetes o no. Y pregunta si puedes hacer ejercicio y qué ejercicios puede hacer. Y si necesitas, también pueden recetar fisioterapia. Managing diabetes, so the 7 self-care tips are really focused around, again, nutrition and activity. We always go to that as the foundation of diabetes self-management, also for pre-diabetes, to prevent diabetes, or just to prolong, to make sure you either stay in the pre-diabetes range or go into the normal blood glucose range. Activity, stay active. This means 150 minutes per week. That's 30 minutes per day, 5 days a week, or 10 minutes 3 times a day, 15 minutes 2 times a day. Staying active is very important. Weight management, keeping a healthy weight for your height, monitoring blood sugar if this is indicated for you, and recording all the results and sharing them with your healthcare provider. Medication if prescribed, taking the medications as instructed. Tell your provider if you stop taking them, even if you just change how you're taking them, the dosing of it. Discuss the side effects. Don't ration or run out of your medications. Make sure you can access and afford it. Problem solving, problem solve with your provider, high, low blood glucose, blood sugars, as far as what you can do, reduce your risk, and the healthy coping you can also discuss with your provider. Your mental state is very important to manage this long-term condition. Manejar su diabetes. Hay 7 consejos de cuidado propio. Siempre la fundación, el enfoque es la nutrición y actividad. La nutrición, desarrollar un plan de alimentación saludable, mantenerse activo y gestión de peso, mantener un peso saludable para su estatura. La actividad física se recomienda 150 minutos a la semana, puede ser 30 minutos 5 días en la semana, puede ser 10 minutos 3 veces al día, 15 minutos 2 veces al día. Lo importante es mantenerse activo. Monitoreo de glucosa, como habíamos hablado antes, y registrar sus resultados si es que se monitorea la glucosa en la casa, y hablar con su proveedor. Los medicamentos, si los recetan, tomarlos como indicado, informar a su proveedor si deja de tomarlo, si cambia las dosis de su medicina usted mismo o misma, y hablar sobre los efectos secundarios, si son molestos, no racionar, ni deje que las medicinas se acaben, mantener sus recetas pendientes y asegurar de poder acceder y poder pagar esos medicamentos que han sido recetados. Resolución de problemas activamente, sea azúcar alta o baja, poder tener esa conversación con su proveedor, reducir sus riesgos y afrontamiento saludable. La salud mental es bien importante para manejar diabetes, que es para largo plazo. General tips for diabetes health: know your A1C, request it from your provider at your next visit if the test is indicated for you. Monitor your blood sugar if indicated between visits, as you are managing your own diabetes in those 3 or 6 months before you go see your provider to the next visit, and discuss the results with your provider and what's going on. Blood pressure, make sure you know what your blood pressure is and what your goal is. Normally it should be under 130/80. Cholesterol, know your numbers and where they're supposed to be, including LDL, HDL, and your triglycerides, not just the whole cholesterol number. Diet and medications, make healthy food choices, medications if appropriate. Exercise, stay active. We already discussed how what the appropriate amount of activity would be. We didn't discuss the type of activity, but you can discuss that with your provider. If you smoke, get help to quit if you smoke. It's never too late, and there are health benefits to quit smoking at any point in time. Consejos generales para la salud de la diabetes. Conozca su A1C. Es importante solicitarlo de su proveedor de salud en su próxima visita si es que ese examen es para usted. Monitorear su nivel de azúcar si ha sido asignado a usted, y discutirlo, hablar sobre los resultados en sus visitas. Saber su presión arterial y mantenerla en menos de 130/80. Colesterol, no solo saber cuál es su número total, pero también el compuesto de LDL, HDL y los triglicéridos. La dieta y las medicinas, elegir alimentos saludables y medicamentos si corresponde. Ejercicio, mantenerse activos, hablamos sobre cuántos minutos, no sobre el tipo de ejercicio en sí, pero eso pueden hablar con su proveedor de salud. Y también si fuma, obtener ayuda para dejar de fumar. Nunca es muy tarde, siempre hay beneficios en cualquier etapa de que usted esté en fumar, en dejarlos. En revisar, hablamos sobre qué es diabetes, cuáles son los riesgos, qué significa el A1C, por qué es importante y por qué es importante trabajar con su proveedor de salud. In review and closing, we discussed what diabetes is. We also discussed prediabetes. What are the risk factors? What is the A1C check? The importance of checking your A1C and why it's important to work with your healthcare provider. And at this point, we'll open it to questions and comments. Thank you for attending this Nursing Community Education Program. Gracias por atender la presentación del programa del Hospital de Cirugía Especial junto con el Hospital New York Presbyterian. Aquí hay algunos lugares donde puede ir para más información. These are additional places you can go for information, which you can review when you replay this PowerPoint slide deck, and make sure you maintain yourself informed. And we have additional contact information, which you can also access should you have any questions or concerns after the presentation. And these are the directions for the poll. So before we get to the poll, I'll see if you have any questions, and then Kenny can review the poll directions.
Right. So there are a couple questions. This was in Spanish, so I'll say in Spanish and then in English, okay? La pregunta es, no tengo un proveedor de atención primaria. ¿Hay instalaciones gratuitas donde puedo hacer las pruebas periódicamente? The question is, I don't have a primary care provider. Are there free facilities that I can do regular testing?
Yes, so there's blood glucose monitoring is one thing. I'll answer in English and then Spanish. Blood glucose monitoring is one thing, but A1C and cholesterol and tests that require a provider, they're distinct, but to obtain care, if you don't have a primary care, is to establish care with a primary care provider, not just going to the emergency room if you feel sick. Definitely knowing what your local clinic is that accepts perhaps payment on a sliding scale per your income or access to care. So it's important. You can just find any local clinic, state or city clinic. In particular, I know you can go to Bellevue in Manhattan, and there's an outpatient clinic side, and you can request for more information there. If anyone knows of any other areas, feel free to share. So la pregunta es dónde pueden tomar pruebas de sangre, depende si es en la casa que lo está haciendo con la máquina o exámenes que requiere un proveedor como el A1C, colesterol. Puedes obtener cuidado, es importante tener un proveedor de salud para mantener su salud y no reportar a la sala de emergencia para cuidado, sino encontrar una clínica local. Puede ver cualquier clínica que esté por su casa a ver si puedes pagar de acuerdo a su ingreso. Y también yo sé que en la ciudad, en Manhattan, el Hospital Bellevue tiene clínica que puede ir a ese lugar para ver cómo puede obtener cuidado de salud y obtener un proveedor de cabecera.
In the meantime, I'm also going to start the poll. The next question is, how important is the total and complete elimination of junk food for people of all ages in all capital letters?
It's very personal. So I'll answer your question. Junk food, we know that processed foods aren't good for us. Sometimes there's a long history, whether it's an emotional component, a behavioral component. It could simply be depending on someone's socioeconomic status, or just simply what the day-to-day is like and the custom of the family, or what the access is to foods where they live. There are so many variables. So when patients or people come to me, family, friends, and junk food is a part of um, their eating habits, I definitely ask if they can eliminate them. But in reality, it's not really realistic all of the time. It's not something someone can do immediately. Maybe they are able to do it over time, but we try depending on where they are in their trajectory in the nutrition. So I do recommend not eating junk food, but if someone is eating them, I don't want to shame anyone for eating it. And I want to make sure I'm treating their health and their care according to their lifestyle and nutrition. And I can always counsel on what I think is right. And at the end of the day, it's really up to the patient as to the changes that they desire, are willing, or can or cannot make. So la pregunta es sobre comida deficientes en nutrientes. Depende porque puede ser mental, puede ser un comportamiento, puede ser historia de comer de esa manera, sea socioeconómica, tener o no tener acceso a diferentes comidas dependiendo de dónde la persona vive. Y para mí, yo no creo que es saludable. Sería bueno si alguien no come esos tipos de comidas, pero también tengo que ser realista, y cuando pacientes vienen así a mí comiendo de manera no saludable, para mí es dar el consejo, y al final del día es el paciente que toma la decisión, pero sí trato de facilitar que no coman esas comidas, y si la comen, quizá puedan disminuir la cantidad o eliminarlo por completo al pasar del tiempo. So I hope I answered the question. If I did not, you can ask again, but I hope it was helpful.
And I have another question. It says, from the symptoms, what should I do right away? If it's early symptoms, can it be reversed?
Yeah, so symptoms are basically symptoms. So when we see a patient, when we see a person, we ask about their symptoms. Then we also have to do a physical exam, and we also have to do blood work. So the symptoms are just part of the story. If someone has symptoms, definitely going to a provider to see what the next steps are. Symptoms that I may have described related to possibly having diabetes are symptoms that can be for any other disease process. It may not be diabetes. So that's why it's important to work with your provider to see what the source is of those symptoms, and get a complete history and physical exam and lab work if necessary. I don't recommend delaying anything. I always say if you have symptoms of something that is out of the ordinary, you really should see a provider to see what's going on. In diabetes, type 1 diabetes, it is not reversed. There is transplantation of the pancreas, but that's a whole other conversation. Type 2 diabetes, we do say you can reverse to the pre-diabetes or no diabetes range, depending on your blood glucose levels. The risk always remains, but you can, in type 2 diabetes and gestational diabetes, prevent or delay type 2 diabetes by simply, not simply, but incorporating the lifestyle modifications, which is nutrition changes, physical activity, and whatever other means your provider can assist you with to get you to a pre-diabetes or no diabetes blood sugar range. And it depends how far along you are in the stage of diabetes in terms of your symptoms and how long you've waited.
I have a comment here. This is regarding the question about not having a primary care provider. If there are free facilities where you could do regular tests. The comment says you could dial 311 for hospitals in your community, and the New York City NYC HAC, which is the New York City Health and Hospitals, should provide free screenings as well.
Right, and if you already have any kinds of insurance, Medicare, Medicaid card, on the back there is a number, and that's the number you should call to obtain a primary care provider. And like Kenny said, HHC, Health and Hospitals Corporation, Bellevue is a part of that. Kenny also informed calling 311. Kenny ha hablado si quieres atención médica, tener un médico de cabecera. Kenny dijo que puede llamar el 311 también. Health and Hospitals Corporation, HHC, que son los hospitales de la ciudad, puede llamar a ver dónde puede obtener cuidado. Y también si tienes tarjeta de seguro, Medicare, Medicaid, puede ver en el reverso el número de teléfono y obtener un médico de cabecera.
And one last question, it seems. The question says, my mother has diabetes, but my father does not. I try to watch what I eat, but what are the likelihood that I can get diabetes?
So we only have likelihood and risk according to someone who may have had or have pre-diabetes or have had gestational diabetes as far as their risk in 5 or 10 years of developing diabetes. If you simply never had any kind of elevated blood sugar, which would have required a physician, a nurse practitioner, a PA, someone doing blood work, then there's no foundation for us to tell you what your risk is, or even just based on your mother having diabetes, or just one parent, what your risk is. We really focus on prevention. So no matter what your risk is, we really want you to maintain a healthy weight and engage in healthy eating and keeping active and setting goals with your provider as outpatient to have a foundation as to where you stand. If you're 45 years or older, you definitely can ask for an A1C and see what your A1C is now, and either work on maintaining it where it is, if it's below the diabetes range, which is less than 5.7, or if you're in the pre-diabetes or diabetes range, again, to set goals for yourself. Alguien preguntó si mi madre tiene diabetes, ¿cuál es mi riesgo de obtener diabetes? La mayoría de los estudios se enfocan en personas que tienen prediabetes o han tenido diabetes gestacional, no tanto las personas que nunca han tenido diabetes, simplemente por un padre o dos o madre tener diabetes. Lo importante es enfocarse en mantener un peso saludable, comer bien y mantenerse activo, y también saber cuál es su estado de salud en este momento, ir a un médico, ver a dónde tiene el nivel de la glucosa y tener un plan. Si ya tienes prediabetes o diabetes, otra vez tener un plan para esa diagnosis. And you can also do the diabetes risk calculator. That's online. You can just Google it. But if you email me, I can also send you a link to the diabetes risk calculator, and my and Kenny's contact information is within these slides when you review it again in the link that Kenny will make available at the end of the presentation through email.
Thank you. I think that should be it in terms of questions. If anybody else has any other questions, feel free to send in your questions through chat. If not, thank you very much, Ruben. Really, really great presentation today. I think this will be our last presentation for the year. Thank you very much, everyone, for joining us today. Esta va a ser nuestra última presentación del año. Muchas gracias a todos por sintonizarnos el día de hoy.
Thank you very much.
Thank you, Ruben. If that is the last, yep, I don't think we have any more questions. Thank you, everyone. Thank you, Ruben.
Thank you. Bye.
Bye-bye. Bye-bye, everyone.
Bye.